We're appreciative of the video, and it's a great way to start our session and conversation around health. And so I want to now welcome Elina Espejo and our subcommittee for health to join us today to elaborate more on the health issues that we see from the community perspective from the San Joaquin Valley and some of the solutions that our community partners are working on as well. Health Committee?
Yes, this is Perfecto Munoz, and I want to thank everyone who is here. We have a great panel and on the discussion on health. As you know, health is really a serious issue within the Central Valley. The number of docs and nurses, as we reported by our congressman, indicates that there is a great need to not only train docs, but increase the pipeline in order to enter into the health profession from K to the UC systems or into the School of Nursing at the different state colleges and university. With that, I have the privilege of introducing a great panel of individuals, and each of them will give you a presentation on different subject matters that relate to health, and some of you may even get a quiz. And so this would be a good time to have your pencils and papers ready, because there's an event that I think you'll enjoy. And with that, I would like to introduce our first panelist. Her name is Nora Zaragoza Yanes, and she is a proud daughter of a Mexican immigrant family from the state of Michoacan. She and her family labored in the fields in Merced. She is well recognized on the issues of immigration and education and how these issues are essential. And she has a real breadth of skills and talents that she really brings to this group in terms of the subcommittee. And with that, I would like to go ahead and introduce Nora, and she's going to talk about her Jeopardy. Nora?
Hi, good morning, everyone. So Nora Zaragoza Yanez. I am the Health Services Manager at the Education and Leadership Foundation, or some of you guys might know it as ELF. And so currently, if we can just pop up some of the questions just to kind of get everything started. And we'll start off with a COVID question, because it seems the pandemic does not want to, leave us. So let's go ahead and just start off with just like a little warm up. So can anyone tell me what is another name for COVID-19? It goes by various names, I'm sure. Some of them funny, some of them sound a little scary. But if you guys are more than welcome to chime in on the chat, or if the poll is live, you guys can go ahead and do your thing. Okay, well, I do see that the poll is there's a couple of questions. So that one isn't really on there. We can go ahead and get started with okay, SARS. Thank you, Margaret. Anyone else? The Rona, yes, for sure. Corona, the vid, yes. Thank you, everyone, for sharing. And let's go with the next question. I definitely would like people to stay as far away from me as possible. But what is the recommended feet or distance that individuals should actually stay away from each other? I've heard 6 feet. Yes. Yes, sir. Yes, ladies and gentlemen, 6 feet at least. And let's go ahead and I'm going to give you guys, I'm going to hit you guys with a reproductive health question. So, what is briefly, if you guys know, when was abortion made legal in the United States? You know that abortion is a big and very heated topic for discussion. But nonetheless, it is definitely something that that does need to be discussed because at the end of the day, we need to make sure that individuals feel empowered in making the decisions, and that individuals, are left obviously to make that decision. So I have seen in the chat someone put 1976. Another individual said 1973 or 1974. The correct answer, 1973. So thank you, Sonia. And we'll go with one more. One more question. So there was an independent poll conducted here in the Central Valley. Um, and a lot of individuals actually support safe and legal access to abortions. So do any of you guys ballpark have an inclination of what percentage of people here in the Central Valley support legal and safe abortions? And I think that number might surprise most of you guys, considering that here in the Central Valley, um, as far as political atmosphere, tends to be a little bit more conservative, more reserved. But like I said, take a wild guess, and you'll be surprised. Actually, 77% of people surveyed fully support legal, safe abortions here in the Central Valley. Thank you, Joseph. Yes, 73%. That was pretty close. Perfect. Do we have time for one more question? Okay. Let's go with a mental. Well, Not necessarily a mental health question, but more of just like a general, did you know? So the Mental Health Student Services Act, it was an act that was passed in 2019, and this act promotes partnerships between a county's mental health or behavioral health department and school districts, charter schools, and the county's Office of Education. And so there was a one-time funding of $40 million and an ongoing funding of $10 million for partnerships, continued partnerships between the county's behavioral health departments and schools. And, given the climate that we are in, this is definitely money that I would, as a parent, I would definitely encourage all of you to. I don't even want to use the term demand, but perhaps encourage your school to see what exactly they are doing, what types of mental health services and resources they're offering for the students. And with that, I will pass it on to Perfecto, Eileen, and Noe.
Thank you very much, Nora. Yeah, there's what we were trying to do there is to give you an opportunity to think what other aspects of how we should be looking at health. This is not a quiz of not knowing what you should know. It's a question of how do we get this information out in the community? Because the immigrant community has many challenges, and we just need to find out what is it that we need to do for them. In other words, asking them the question, what is it that you need? And I think that these are the core principles of what we're trying to do with the health committee. I would like to introduce our second panelist. His name is Noe Paramo. Noe Paramo is a staff member of the California Rural Assistance Foundation and as a project director and legislative advocate. He's been in that role for 15 years, and he works, and his office is in Modesto, California. He's served on many different organizations, nonprofits, and addressing issues of access to care, social justice. And in 2021, Congressman Harder presented Noe with a certificate of congressional recognition for the Central Valley Leadership Award. He is from a immigrant and farmer family. And with that, I would like to introduce Noe Paramo.
Thank you, Perfecto. Hello, everybody. Good morning. Buenos dias. As we hit the noon hour, we've had 2 days of very, very good presentations, information, education, and action work that's going on in the Valley. So as we now look at the health priority issues for the San Joaquin Valley, it's part of the IHEAL platform. We will hit some of the priority areas that we're addressing. And next slide, please. Thank you. As an introduction to the Health Subcommittee, we have our co-chairs, Nora Alejandra Zaragoza Inez, as she just welcomed you with the game of Jeopardy, so that we wanted to be interactive and allow you to participate and think as well on these hard-hitting issues that are impacting our community. And just to comment on these, so COVID-19, we know the last 2 years has really hurt us and impacted our immigrant community. And so those are critical questions. And as we still are going to equity on the mall in a virtual setting, we know that's why it's important to know. Then our reproductive health, that is happening, will happen next month as the Supreme Court gets ready to issue a decision on Dobbs v. Jackson Women's Health Organization, which will have drastic impact on the constitutional right of women's right to choose, the right to have an abortion, which may reverse Roe v. Wade, long-standing case, as the question was asked. And what's that mean to the Central Valley is that can have a drastic impact on our communities of color, low-income women. And as we know, the questions are around who's looking at that, we know what these surveys show, that we are supportive. So as these issues, cross-cutting issues emerge, we're adopting and pivoting our policy agenda. And the last aspect was also on mental health. And we know the stress is impacting our communities from COVID-19 and then the other issues. Just to acknowledge, our presentation was put together by Elena Espejo with Children Now, Perfecto Munoz acting as MC with West Modesto Community Collaborative, Margarita Santiago Vázquez with Centro Binacional para el Desarrollo Indígena Oaxaqueña, and myself and others. Just a little glimpse as to Socorro Santillan and Pam Wayland. Thank you. So a little glimpse of who the Health Subcommittee members are, and we represent a wide, diverse group throughout the San Joaquin Valley, and you see them there on the screen. So we acknowledge their participation, their work and leadership on health issues in the Central Valley. Thank you. Next slide. We've established a vision, and this vision is part of our iHeal platform. And now we're into the second year of this iHeal platform as it relates to the Health Policy Subcommittee. And our vision remains strong to strengthen California's commitment to and momentum toward increased access to high quality, affordable, culturally and linguistically appropriate physical and behavioral health services, regardless of race, ethnicity, immigration, status, age, sexual orientation, gender identity, or other social, economic, and demographic factors, so that every Californian has the opportunity to thrive. Thank you. Next slide. And here are our key platform priorities for 2022 and the pathways. Number one is to address health disparities at the local, regional, state, and federal levels. We stand united in our call to support federal efforts and comprehensive immigration reform with pathways to citizenship and eligibility for federal benefits. And as we saw and advocated with our immigration partners to bring comprehensive immigration reform at the federal level, unfortunately, it fell short. There was an effort to get the Senate parliamentarian to fund immigration reform. It did not happen. That will not cease. We see that as the critical pathway to eliminate barriers for our immigrant communities, particularly our undocumented, so they can access benefits that have been talked about from our partners, anywhere from Medi-Cal to food stamps to sick leave, etc. We strive to educate our immigrant community on current status of the public charge regulations and encourage participation in health and nutrition programs. And as our immigration partners transition, we understand what the public charge rule is, what it is not, and we know that we need to continue to educate our community so that they can access these vital programs. And then finally, expand investments and eligibility in the Medi-Cal program to close the healthcare gap for all uninsured residents and seniors. And so this is a multi-pronged aspect here. This is our key priority area, is to expand Medi-Cal to eligible undocumented immigrants. We know that 18 and under children have been eligible for a couple of years. The expansion happened for young adults from 19 to 26. And just this year, May of 2022, we saw 50 and over expansion, and that effort is underway to educate and inform and enroll our seniors over 50, regardless of immigration status, and documented into the program. This is where the outreach around public charge is critical. Now we see in the governor's budget, and we also see, this has just emerged yesterday in the legislative joint budget for the Senate and the Assembly, that they concur on expanding Medi-Cal to the 26 to 49 years of age. Now, the question will be, When will that happen? It is soon as the summer, possibly, but no later than January of 2024. So we know that as of January 2024, all immigrants that are eligible, undocumented, from children to seniors, will be eligible for Medi-Cal. This is truly historic. It's never happened. It's just another step on the way to comprehensive insurance for everybody. Now, does this mean that we will cover everyone? Well, there'll still be gaps, and we will also continue to work through our work with our partners to close those gaps so that everyone has access to health care, and so health for all. So thank you. And we, at this point, we will introduce a testimony from one of our residents. If we can cue that up.
Hola,
Video.
mi nombre es Guadalupe Ramírez, vivo aquí en Fresno, en California. Soy originaria de Tlapa, Guerrero. Yo hablo mixteco. Hoy quiero compartir mi historia acerca de acceso a la salud. Tengo 34 años y no soy elegible para ninguna ayuda, especialmente al acceso a medical por mi estatus migratorio. Yo soy una de las tantas personas que quedaron afuera de la expansión de Medicaid en California. Yo soy una trabajadora del campo y para ir al doctor tengo que pagar todo de mis propios bolsillos. Y con lo que gano en el campo no me alcanza para cubrir mis gastos médicos. Muchas veces tengo que decidir entre mi salud y el bienestar de mi familia, como comprar alimentos antes de hacer gasto médico. Ya es hora que California dé medical completo a todos los californianos sin importar su estatus migratorio y edad. Hoy pedimos el apoyo del gobernador asambleísta para que pase una legislación a que todos los californianos tengan medical completo. Gracias.
Thank you for that testimony. We are there, very close. The final budget comes June 15th. We will see that funds to close the gap on expanding Medi-Cal to undocumented. The next will be the implementation as by January 1, 2024. It could come sooner, and we'll see. So next slide, please. Also, to ensure the equitable distribution of the COVID-19 vaccines and other relief resources to the communities and populations hardest hit by COVID-19, regardless of immigration status. And COVID-19, and we've been listening to the stories from our other partners and the other iHeal platforms that work around COVID. This is also very critical to health and access to health. The state has a program, California Presumptive Eligibility Program, to access health coverage and treatment you hit with COVID-19, regardless of status. Now, as we're going from a pandemic to endemic, the state still recognizes this need. We recognize this need foremost in the Central Valley, where we had some of the highest rates of impact and also deaths than other communities, particularly around our communities of color. And as we're looking at, so what are these resources? And who eloquently in the immigration panel says, looking at resources, we now see that both the governor and also the legislature and their joint policy is that additional funding for COVID-19 outreach totaling $230 million will be forthcoming in the 22-23 year. That's a good chunk of money. Is it enough? We'll see. But this is where our work at the local level with our partners needs to make sure that money is implemented correctly. It gets to our most marginalized communities, and that we then work with each other in our community-based organizations to make that, continue to make that happen. Next slide, please. Ensure that youth and adults are able to access behavioral health supports necessary as a result of the public health emergency. And that's very critical. We've heard about mental health and stress issues. And one of the things that we're also looking at as we look at what's happening in the budget, and I raised this because that's happening now. Our platform has identified these key areas, and we're seeing the allocation of resources from the governor's office and the legislature, and where our needs are met and where they're going to be lacking that we will need to be more offensive or defensive on going forward. So we know two things. There's going to be a behavioral health bridge housing money totaling $1.5 billion over the next 2 years. And also that youth suicide prevention and behavioral health funds at the total amount of $290 million. And so we need to assure that that money is implemented locally in an equitable and just manner. So another amount of money we need to track and work with our community-based organizations to ensure that it really meets our needs. And next slide, please. Support policies will address food security issues experienced by families and individuals as a result of the public health emergency. And we saw during this COVID-19 pandemic the need for food assistance. And that has not gone unheard, but there's still more work to be done. And we know that there's going to be funding in the budget and also to provide food assistance. Now, is this going to be enough? We'll wait and see. But one thing for sure we know is the amounts of money. Let me bring that up. And three areas: universal school meals. Funding will be provided through the governor's budget to reimburse rates for school meals under the state's new universal school meals program. That's good for our kids. We need to pay attention to that, particularly those school districts and our education committee partners, those advocating for quality nutrition meals at schools. Facilitating food access for all, $35.2 million, and that is increased to $113.4 million. Now, and that's to expand the California Food Access Program. That's good. Undocumented immigrants are not eligible for the program, but it's going to be expanded to the 55 and over. That's great. However, there's still a gap. 55 and are not eligible at the moment. So we're seeing these funds coming out. So there's still more work to be done. Nutrition and hunger, $62 million for 2022, 2023, of which $52 million will go to California food banks. So on top of that, there's going to be another funds that also will go address food access for Native American communities in the total amount of $5 million. So the need for our undocumented communities to access food assistance is critical. There's still more work to be done. Again, we're being offensive, but we're also playing defensive, not to take anything out. And we'll see what the final budget has for us in food nutrition come June 15th. Next slide. Thank you. Thank you for listening and supporting our work. Our health policy platform, you've got an area of priority that we're working on and also adjusting to and pivoting as this work emerges across the valley. Thank you very much, and I'll turn it back to Perfecto.
Thank you, Noel. It was a great presentation. It gives you a group of those of you who are listening and seeing this presentation an opportunity to see the kinds of things that are out there that need to be continually addressed. And there are going to be an opportunity for question and answers. But at this, I would like to introduce Elaine with Children Now, and she will be speaking a little bit about what they're doing in terms of her involvement with the health committee. Elaine?
Hi, thanks, Perfecto. So I think you all met me yesterday, or for those of you who were at the opening yesterday. So I have the pleasure of co-chairing the overall policy committee with Noe Paramo, and I'm also a member of the health subcommittee, so helped in putting this presentation together. At Children Now, we've been really tracking what's been happening with all of the children in the state that are enrolled in Medi-Cal. So we're super concerned about not just coverage, because coverage is one part of the puzzle. It's also about access to services that children enrolled in Medi-Cal are entitled to. So we've been tracking, as Noe so eloquently referred to in the budget, there are a number of proposals that both the Senate and the Assembly had reached that joint agreement on yesterday. And the things that we're tracking and we're really pleased to see were the proposals to expand continuous Medi-Cal coverage for children ages 0 to 5 years old, because we know that there are often problems when the children in this age group might fall off of coverage for whatever reason. And so just the idea that families don't have to worry about their youngest children being unintentionally kicked off or just not enrolled in Medi-Cal is a huge security for these families. And then the other thing that we're also tracking is the elimination of premiums and co-payments for children who are enrolled in Medi-Cal. This also includes the elimination of premiums and co-payments for pregnant people and for disabled adults. So we are very thankful for the Senate and the Assembly for recognizing that these are essential coverage benefits that need to be met. And then at the same time, as we've been talking about, making sure that coverage actually results in the health benefits and the services that these populations so desperately need and were further exacerbated by the public health emergency. The only thing I also wanted to touch on, I know when Sergio introduced me, he talked about all the oral health work that Children Now works on. We are working in partnership with a number of local health departments in the Central Valley that have created local oral health strategic plans to address the oral health of all the residents in their communities. And so that's something that we continue to do to just make sure that the local oral health programs that have received funding from the State Office of Oral Health to create and implement these oral health programs are leveraging, building partnership, building community, and also engaging in policy advocacy where it's needed, either through legislation or maybe it's through talking with the agencies that oversee Medi-Cal, just trying to lift up and share stories of how it might be really difficult to find a provider, for example, or understanding where a school might be offering screening services. All those things are the other things that we want to lift up. So that's, I think, basically all I wanted to offer for this in conclusion of the presentation that Noe shared. Perfecto.
Okay. Yeah, thank you very much. It's always good to hear what Children Now are doing, because they play an intimate role in advocating for children and ensuring that they receive the best care statewide. The vulnerable population in California, specifically among children, is very daunting. And many of these children during the period of the pandemic suffered dramatically because of the trauma when a family member passed away, or what's going to happen to my mom or dad if something happens to them. Where am I going to go? Who's going to take care of me? These are the kinds of things that we really have seen during the pandemic period, and even post-pandemic. We still see families coming in. One of the questions that has been asked is about the essential workers, and that's a two-part question. One from the chat, and one that I would like to mention too, is that the essential workers show up during the pandemic, meaning the roles of providers, the nurses, the docs, and what more can we be doing for them in order to provide their support for essential workers during this period of time, especially with the mental health, the scene of death on a daily basis. And so I would like to put that out to the panel, and maybe Noe, maybe you might want to take that on, or Elaine, or Nora. So whoever wants to take that question on, and then I'll have the second question. Nope.
I can answer just part of the question in regards to what it is that we can do as far as mental health, physical or emotional ways of support. For sure, mental health, I think if there are businesses or organizations that do not have a relationship with their with mental health providers, that it would be a really good time, if they haven't done so, to reach out to them and really invest in their health workers, because that obviously shows that you genuinely care for them, and that you acknowledge that they are, they're at the front line and they're doing everything that they can. And sometimes we just need someone just to listen to us, and that is not going to offer any biased opinion or any judgmental opinion. I mean, and that's, again, what mental health care providers are there for. And I think that that's um, an untapped service that we need to start. Tapping into, and we really need to invest in that. As far as other things that we need to do for healthcare workers, give them time to additional time to, whether it is they're recovering because they had COVID, or because they're dealing with, or they're taking care of another family member. I understand that there's already laws in place to do that, but 80 hours in total doesn't really cover it. And I understand that it might, smaller organizations might be impacted by it, but I mean, just truly investing in your workers in general will definitely, it says a lot. It speaks volumes.
Thank you,
Okay.
Nora. Perfecto. I'll just add, specific to farm workers, one of the areas we focused on during the pandemic was prioritizing the farm workers get vaccinations. So then also to get benefits. And through our staff, when we conducted webinars and we trained the promotoras where we could in the community, so that they're informed of what rights workers have and where they can reach out for consults. And we're also worked with UC Davis and Perfecto with the West Modesto, Hugo at Radio Bilingüe, Oralia at CVDIO, through the Orale testing project. And where the van came out to the fields and tested farm workers, then did more wraparound services to connect them to resources such as mental health, and also what other funds or resources each county had. The third area is farm worker health study that's going on at UC Merced, and we're collaborating with them. We have not had a updated farm worker health study in 20 years. And this study is happening during the pandemic, and a section of that study is going to focus on the pandemic, and farm workers are interviewed. We're going to get that results of those interviews that address these broad questions, including mental health, physical health. And we will see from that data where we can really hone more policies to target the needs of our farm workers in those specific areas. And we hope to have that sometime this summer, as it needs to go back to the legislature. Thank you for that question. Very, very good one.
And Perfecto, I just had one more thing to add on to this question. I also wanted, I think this came up during yesterday's afternoon presentation, and just recognizing the essential role of childcare workers, and the enormous stress that they have experienced. Some had to close their doors because of the attendance drops, both in K-12 and for preschool and just family childcare homes in general. So there are a number of things that are going on right now, both with the state budget, in terms of ensuring that childcare workers are seen as essential workers in terms of the services that they provide to keep California working, to support the families that are ready to go back to work but need that essential childcare service to be provided. So just wanted to recognize, I think what I would love to see in health, just generally and across the board, is the broadening out of what do we mean by health for health for all, like health for everyone that's providing health, health for everyone that is helping families feel less stressed, health for just everything that keeps our communities working together and feeling whole about what they're doing.
Okay, thank you. And those are the topics that we need to continuously ask ourselves, because the pandemic is not over. We're having a down decline, but yet we're also seeing a uptake in the number of the current virus that is spreading in California and across the country. The other question I have for the group is, we talk about health access and the essential of services, but what is it that we need to do more for those rural communities, small rural communities in the Central Valley who have limited access to services? In some cases, they may have to drive an hour just to get to a emergency room or to a physician. What kinds of things should the state be looking at, and what do you think you would, if you had to recommend to the governor, what would you recommend? And this is open to the group.
How much time do we have? I will just quickly offer, and I think I've heard this before during the past 2 days, telehealth is huge for rural communities and other parts of the state where access just isn't there. This is recognizing the dearth of providers who enroll in Medi-Cal for a host of reasons, but really trying to leverage the workforce that currently exists and leveraging the technology, which also loops in with the digital divide, because you need to make sure that there's the adequate access. So trying to show the intersectionality between all the different things that the iHealth policy platform tries to address. Bringing care to where the people are is part of the triple aim or quadruple aim, I think, at this point, right? So bringing care to people are identifying those culturally competent cultural workers who have cultural humility to be able to identify what do they need in their workforce in order to deliver the services in the way that need to be delivered. And I would also offer, it would be amazing to make sure that the agencies that are in charge of the contracts to the Medi-Cal managed care plans and others that are receiving money to deliver these services are truly held accountable for health outcomes. So not so much from where I sit in terms of making sure a service was delivered, but was that child or that adult or that person, were they healthier because of the very service that was provided? Did we keep them out of an emergency room? Did we keep them out of needing to travel all those hundreds of miles to find a specialist if we were really pushing prevention? I think all of those things would be amazing if we were able to truly get on that track and get more voices involved to demand that we all understand prevention is so much cheaper than having to go in for restorative services. So how can we really prioritize prevention and make sure that we're delivering that care in a way that is culturally competent?
Noe or Nora, do you have a comment?
Oh, for sure. Oh my gosh, where do I begin, Eileen? But one thing that I can add as far as being culturally competent in offering, healthcare services is obviously knowing your community, recognizing that the majority of individuals that live here in the Central Valley are farm workers. And so these services have to extend their hours of operation to be mindful that an individual is going to come home from work from a long day of work in the fields, 5, 6, even 7 o'clock at night sometimes. And so though it might not be beneficial to say like the clinic or the healthcare provider, it's a disservice to not extend your hours of operation to see these individuals. And even if you don't want to extend them during the week, open up during the weekend, hire additional staff. I mean, those are just the things that at least I like to continuously, champion, the clinics and the other healthcare providers that my current CVO, helps in making sure that individuals actually do have access to these services. That's about it.
I would affirm Eileen's and Nora's comments. Very critical for access in our rural, isolated farm worker communities. These issues of transportation, care, prevention, intervention, telehealth, the digital divide. And as we see, and I go back to the budget because this is what's happening now, is there's the surplus, and we see the governor and the legislature putting this funding in, and there's going to be a deal done. Now that funding is going to be on the table. What do we do with that funding to get it to our rural communities? And two pots of money, one I talked about was the COVID money, but another pot of money that's going to come out, it's called, here it is, Office of Community Partnerships and Strategic Communications. It's a new office that's being created under the Office of Planning and Research, $65 million that will engage community-based organizations. This is to fund the community-based organizations in those greatest health and social inequity areas, so rural areas. Now, that's what's important. Fund our community-based organizations. Now, how do we implement it, how we see it, how it meets the needs of our residents is going to be critical. On the other end is, here we are, $300 million to the public health infrastructure. And this is to invest in our local health departments in the San Joaquin Valley. They've been under-resourced. Now, when you're going to bring this money in, we made sure that that money gets to our communities and also partner with our community-based organizations. So there's opportunities, but there's needs and challenges. And as we know, it's working with governments and institutions. It's not always that easy, but working with our residents to tell them what they need, we can get improved access for care and coverage.
Okay.
Thank you for that.
Yeah. All right. I'm not sure how much time we have, but I'll keep going. I have one other question, and then this one has to do with what the congressman had to say in terms of trying to build a medical school either at UCSF Fresno campus or UC Merced. What is the role of community or community-based organizations to working with those critical decision-making about how we develop the infrastructure and the pathway to increase the number of bilingual Hispanic providers within or any other group, ethnic group, into the health profession? What is it that you see the community's role or the community-based organizations? It's a question I don't know if anyone can answer, so I just thought I'd throw it out.
I will gladly answer that question. Perfecto, thank you. So as a health services manager here at my CBO, one of the things that I see for sure is that CBOs are definitely left out, especially in in the area of health, just because we don't have clinical licensures or degrees that doctors have. But that doesn't mean that we can't help an individual make sure that they're actually following through their doctor's orders, making sure that they know what resources or services are available to them. One of the things that one of the pilot programs that I would definitely want to start doing, given funding, would be having this referral system where it's like, okay, and then we as CBOs can handhold or walk through with with the patient and making sure that, okay, if my doctor stated that I need this type of medication, or that I need to properly account for the times that I need to take my pills, actually have a community health worker from a CBO sit down with them and go through what it means to follow a regimen. And it could be as simple as them coming every single day and making sure that they're checking off, on their list, like, oh, did you take this medication? Oh, make sure that you don't, that there are any, medical or medication interactions. Or if you need help, or if you actually need a ride to your next doctor appointment, we can definitely facilitate that, and we will definitely help interpret anything and translate anything that you need. So that is a role that I see CBOs definitely playing, because like I said, a lot of the time our community members aren't English speaking, and so sometimes the translators or the interpreters that are that are being that are offered, sometimes the services aren't as reliable. And so I want to make sure that they have a wholesome, they have a comprehensive, health, service that's available to them. So that's what I definitely, see. And I recognize again that we're not trying to say that we could take care of the clinical stuff. Any non-clinical things that that we can take off of the plate of an already exhausted healthcare force, we would gladly do that for them.
Okay.
Hi, Perfecto. I know we're getting close to the end of our time here. I just wanted to offer that there is a community health worker benefit that's going to go live starting in July that will allow for community health workers to get reimbursed for certain services that are provided. So that would include, things like education, helping with just navigating the system. I do want to also make sure that people are aware that the Department of Healthcare Services has been working on putting together a guidance document for the managed care plans and for community-based organizations that either hire or train the community health workers. And it's critical that we make sure that guidance document reflects the community health workers that are providing these services. And the only other thing I'll add is with the CalAIM initiative, there are a number of provisions within CalAIM that require the Medi-Cal managed care plans to be working in partnership with community-based organizations to figure out how are they delivering, again, this care, enhanced care management, helping provide the transportation services, all of those things that, again, that we just need to make sure as a community of stakeholders that are concerned with health, that what is being put on paper is accurately being delivered. It's one thing to be on paper and another thing to be implemented.
Yeah, and I agree with them. Those are the critical discussion points that need to be addressed in terms of the CalAIM, because we've been experiencing it, but we don't understand how the process is going to continue or how it plays out. With that, we are finished. We need to. I would like to thank the panel. They did an excellent job, all three of you, and I turn it over to Sergio Cuellar, and he will introduce the next group. Thank you very much.
Thank you, Perfecto, and the Health Subcommittee. That was a very, very informative and interactive session. We appreciate it.